we are going to go through a shoulder mobility exercise. What you want to do is you want to stand close to the wall. So if your shoulder mobility, say you go to do this exercise and you're out here, all right, we want to work you to the point where you can get pretty close to the wall, about your fist width away from the wall. Now, if you don't have a slider, no big deal. You can actually just do this with your hand on a wall. So what we're going to do here is we're going to put the soft side down on the wall, and you're going to start with your palm facing this way. So your palm facing in. Now I'm going to stand about my fist width away from the wall here, and I'm going to start with my hand down at my side. Now when you're doing these type of exercises, I don't want to be in an extended position, and I don't want to be slouched forward, because then we can't get the shoulder to move as far as it needs to go if I'm in a slouched position, and you may get some pain on the front of the shoulder as well too. So little cue for you. What I like to say is let's stack the rib cage. So here's my rib cage, the bottom of my rib cage, and here's my hip bone. So we want to stack that rib cage so that you've got a nice even line from the front to the bottom. Nice soft back here. So we want to have some curvature in the back, not a ton. Okay, so I've got a nice soft back, strong core. I want to take a breath, and you can even brace it as well. The eyes can open up quite a bit of mobility, in my opinion, and give you a little bit more proprioception, because you can see what you're doing. If you have limitations in joint movement and you can't see it, am I doing it right, is what patients say a lot of the time. Am I doing that right? I can't feel it. Their body is not sensing the movement correctly, or the movement capacity that they have, which is a really interesting point. So I like to use the visual fields to guide it. It's one of your main sensations or input fields for you. So we're going to follow with my eyes. I'm going to get to the top, and then here is the key. I want to keep my body as straight as I can, but I'm going to rotate just a little bit more and follow my hand down the wall. Okay, so we'll do that one more time. Allowing for a little bit more rotation, flipping the hand, and then coming all the way back down.